Imagine you're driving in your car when the warning lights go on, suddenly, unexpectedly. You make your way over to a mechanic, and several hours and a bit of cash later, you're told everything checks out. Engine, brakes, there's nothing wrong with your car. But the warning lights went on. I saw them. There's nothing wrong with your car except that maybe it's crazy. As silly as this sounds, a version of this story happens every minute of every day, not to cars, but to people in emergency rooms and medical clinics across the country and beyond. Here's an example from my own work as a psychiatrist. After I finished medical school and 4 hard years of training to specialize in psychiatry, I did what everybody expected me to do. I moved to rural Alabama, I hung out a shingle, and I set up my own practice. Now, an Asian American woman psychiatrist in the Deep South is an interesting story in itself. But instead, I'd like to tell the story of one of my patients, who I will call Tony. Tony was a truck driver who worked for one of those companies where he had to produce more every year. Imagine that. One day, while driving hard to meet a deadline, under pressure, Tony felt a pain in his chest, like a knife stabbing. He grew short of breath, his face grew numb, and his stomach hurt. Tony went to his doctor, who, out of concern, ordered a complete cardiac workup, including treadmill tests, echocardiogram, and even an angiogram, a semi-surgical procedure. Tony was told there was nothing wrong with his heart. So he got back in his car, was driving, when another attack happened. This time, Tony's gallbladder was removed. The attacks continued, so some teeth were removed. The attacks continued, so Tony got a second cardiac workup, and again was told there was nothing wrong with his heart. Finally, Tony was sent to me, a psychiatrist, and after everything he'd been through, this is how his panic attacks finally stopped. I said to him, the purpose of breathing is to change the chemistry of every cell of our bodies each minute. And that is the entire reason why we breathe. It works faster than a pill that travels from the bottle to your mouth, to your stomach, to your bloodstream, and then to your nervous system. I said to him, put your left hand on your chest and your right hand on your belly. Come on, if you want, please do this with me now. And breathe, trying to keep your chest still and breathing using only the muscles of your diaphragm and your belly. Finally, this is how Tony came to stop the attacks. As a psychiatrist, I have a lot of tools in my toolkit in addition to medications. A lot of these tools have research backing them. They're not new, they're not experimental. Tools such as exposure therapy, which is when I tell patients or I teach them how to confront their fears and overcome them instead of avoiding their fears and letting the fears grow and their lives grow smaller. Or something called behavioral activation, which is basically getting out there and doing things and experiencing things instead of staying home and brooding. A lot of research shows that these techniques work. I had taught these techniques at the University of New Mexico School of Medicine to psychiatrists in training for 10 years. I've seen them work for patients even longer than that. They work. According to the National Comorbidity Study, which is kind of a gold standard in my line of work, about 31% of us will suffer from an anxiety condition sometime in our lifetimes, with symptoms such as chest pain, shortness of breath, dizziness, stomach pain, etc., etc. About 21% of us will suffer from a mood disorder in our lifetimes. it is pretty well established that about half of visits to emergency rooms and primary care doctors are for symptoms that are ultimately medically unexplained, no physical cause found. And this is the most expensive healthcare system in the world, where $1 in $5 goes to healthcare. For anxiety alone, an estimated $42 billion a year is spent, a lot of it on unnecessary medical care and tests, such as what happened to Tony. I'll just say right now, if I get so nervous in front of you all, and I get chest pains and I fall over, and you guys rush me to the emergency room, I'll for sure get a complete cardiac workup. But it's very unlikely I'm going to get any help for anxiety, the real problem. When I was just 19, my big adventure was that I worked in Washington, D.C. as an intern in the Public Health Service. It was the 1980s, so it shows my age. But the office I worked in ran public health campaigns about smoking cessation, about the importance of diet and exercise. Public health campaigns like that have done more to decrease cardiovascular disease, to increase the health of Americans, more than medications, surgery, devices. And here's my big idea. I think it's time for a public health campaign focused on mental health. I agree with you. Mental health issues have reached crisis proportions. Psychiatric medications are prescribed more widely than any other medicines. There's Prozac in the groundwater of every major city of the world because of the multitudes taking it and excreting it. Yet, it's well established that certain techniques, especially cognitive behavioral therapy, work as well for most people. And indeed, I remember when it was thought that these techniques and therapy and life changes were the real answer and the medications were just a Band-Aid. In any case, I think it's time for a public health campaign focused on mental health. We should do it for humanitarian reasons, for people who are suffering and not getting the help they need, for a safer, more stable society, even for the economy. In the meantime, who's crazy? Patients who are not getting the emotional help they need, or our healthcare system?